What recent changes have affected Medicare and Medicaid programs? Have you heard about the recent changes affecting Medicare and Medicaid? These updates stem from a significant federal budget reconciliation law enacted in 2025, which has introduced several important provisions. For Medicaid, one of the most notable changes is the introduction of work requirements for eligibility in many states. This means that certain Medicaid beneficiaries must now meet specific work or community engagement criteria to keep their coverage. According to the Congressional Budget Office, these work requirements could reduce federal Medicaid spending by around $326 billion over the next 10 years. However, this comes with a significant downside. Millions of adults are expected to lose their Medicaid coverage, with an estimated increase of 4.8 million uninsured individuals by the year 2034. Many of those losing coverage may not find alternative insurance through employment or the Affordable Care Act marketplaces. This is because the law restricts eligibility for premium tax credits for those who are disenrolled due to these work requirements. Currently, 41 states and Washington, D.C. have expanded Medicaid under the Affordable Care Act, but these new requirements could reverse some of that progress. On the Medicare side, recent changes include adjustments to payments made to health care providers. These adjustments may affect how services are delivered and the costs associated with them. These changes are part of broader policy shifts under the 2025 budget reconciliation law and other administrative actions. Additionally, factors like immigration policies and tariffs are influencing Medicare costs in indirect ways, although the specific impacts on beneficiaries are still unfolding. These changes have raised concerns among health advocacy groups and organizations that representing older adults and low-income populations. They warn that cuts to Medicaid and Medicare could limit access to essential health services, especially for vulnerable groups like the elderly, disabled, and pregnant women. Organizations such as the Medicare Rights Center have condemned these cuts, describing them as rushed and harmful. They emphasize the potential negative effects on health outcomes and economic security for many individuals. In summary, the recent changes affecting Medicare and Medicaid include the implementation of work requirements for Medicaid, leading to significant coverage losses and federal spending cuts. There are also adjustments in Medicare provider payments that contribute to cost shifts within the program. These developments reflected a trend toward tightening eligibility and reducing federal expenditures in these major health insurance programs, which could have important implications for beneficiaries and the healthcare system.